One in 3 injuries among healthcare workers is caused by moving and assisting clients. These injuries can be reduced by using ceiling lifts to transfer, reposition, and turn clients. However, lifts are not always being used, and here are some common reasons.
Hello, Miss Henderson. We're just going to reposition you. You've been on your back for a couple hours.
Leaving a repositioning sling under a person has been shown to promote repositioning and reduce the incidence of pressure ulcers.
I'm just going to lower down the carrying bar. I'll just grab a shoulder strap, hip strap.
Repositioning slings can be left on all types of mattresses.
Tuck that underneath you.
Always assess your clients and develop a plan that allows you to provide safe care while taking care of yourself.
Helene, I really wasn't sure what to do with her IV and just kind of protecting it, so I just wanted some help.
Right. Not a problem. It's really simple. What we'll do is
After surgery or with certain wounds or conditions, many clients require special consideration when using a ceiling lift.
and then you can just go around back.
A care plan can be implemented that will minimize the stress on your body and reduce your chance of suffering an injury. Tell your supervisor if you are uneasy using the equipment with certain clients. And don't be afraid to ask your colleagues for some tips.
That worked well for you. I'm just going to take this back.
So what we're actually going to do is we're going to move your mom back into bed, and we're going to use a ceiling lift to do that.
Ceiling lifts are the safest, most comfortable way to move and assist people. With every new client, communicate with the family that at some point their family member may require assistance.
You're looking fine. No concerns. It's good that your daughter's here to check it out and see how we actually transfer you. We'll lower you down.
Lifting a client without a ceiling lift is awkward and requires a lot of physical effort. For your safety and the safety of your client, use the lift.
Well, we're going to lift you up out of bed and bring you to the chair.
A manual transfer only takes a minute and isn't sufficient to improve a person's strength and mobility.
Here we go.
Before deciding to move someone, you need to check their abilities. If there's any doubt that they can't support their own weight, then you definitely need to use a lift. A fall will only set a client back. Not every moment is a rehab moment.
Hi. So what we're going to do is we're going to use a ceiling lift to get you up and seated for a little while so you can get out of bed.
Any adult that requires more than minimal assistance is too heavy to safely transfer or reposition without using a ceiling lift. You wouldn't lift a 100-pound box, so why would you manually lift a 100-pound client?
Perfect. There you go. Yeah, that looks good.
Use your skills as a care worker to their fullest advantage and let the equipment do the work.
Hi, Mrs. Henderson. You seem to have wiggled down the bed, so we're going to reposition you back up and make you more comfortable.
Even though it is a very short distance, boosting a person requires a lot of effort, and it puts both you and your client at risk of injury.
Couple inches off the mat.
Over time, the damage to your body builds up, putting you at even greater risk. Use a ceiling lift. It's safer for you and your client.
Great. I'll get Leah to return that. And she'll lower your bed. There you go. Are you comfortable?
Yes. Hi, Mrs. Henderson. You seem to have wiggled down the bed a little bit, so we're going to reposition you back up and make you comfortable.
When medically safe to do so, a repositioning sling should be kept under a person to reduce any additional turning. With proper equipment and practice, using a ceiling lift doesn't take much longer.
See, now you look much better, a bit more comfortable, a bit higher up in the bed.
Moving and assisting people is the leading cause of injury in healthcare, and ceiling lifts are the best way to reduce the risk. Client assessment and the appropriate use of ceiling lifts will help you achieve quality care and keep you safe from injury.